Cygnus Medicare is working in the field of healthcare for providing tertiary care in district towns of North India. Even 65 years after independence, we are unfortunate that we have not been able to provide tertiary care, particularly emergency tertiary care like uh, services for heart attacks or patients suffering from trauma or patients requiring neurosurgical problems requiring treatment. People have to travel from our even from our district places to bigger towns, tier 1 cities or metropolitan cities for treatment of trauma and heart attack. And what to talk about even smaller places, sub-district or tehsil level, where you don't even get the primary or secondary care in proper form. So Cygnus studied this evolution of healthcare very closely and found out there is a huge need of emergency services and tertiary care services and super speciality services in district towns of North India and the country as a whole. So we all studied and sat together and found out that we should do something very good in this space to provide healthcare at doorsteps of people, at least in district town and at some later stage into sub-district and tehsil level. And when we were discussing this, we found out that particularly in trauma, there is a comprehensive care required. If somebody meets an accident on, let's say, national highway, he has to travel at least minimum 100 kilometers to get the basic first aid in a proper form. And if you have to provide trauma service, you need to have a full-fledged team, including neurosurgeon, orthopedic surgeon, a general trauma surgeon, a radiologist, a round-the-clock intensivist, a very good background of intensive care where you require ventilators, monitors, etc. Then you require a very high-end casualty, a very good advanced life support ambulance, a backup of blood bank. So it is a comprehensive care when we talk about providing a trauma service. So we decided to develop this as a first stage in every hospital in district towns as a trauma service, and that is what we did in last 3 years. Today Cygnus has 9 hospitals, out of which 5 are in district places of Haryana and 4 are in Delhi. We were actually surprised to see that even places as close to Delhi as Sonipat and Panipat and Bahadurgarh did not have these basic super speciality services. So now in all these hospitals which we just mentioned, we have a full-fledged trauma department which includes various specialists, which includes that infrastructure supporting these super specialists. We have a support of blood bank, we have a very good intensive care, we have round-the-clock specialists to cater to these services. And now we are moving towards a next phase of cardiology in these centers. We are trying to provide cath labs in all of our district hospitals. We already have 3 cath labs. We are in the process of setting the 4th cath lab in Karnal in coming 6 months time. And we've tried to provide cath lab and cardiology service in each district town of Haryana. Haryana has 21 districts, out of which we already have presence in 5. There are other players in Gurgaon and Faridabad and Hisar who are already providing tertiary care services. So we are looking towards expanding into the rest of the 13-14 districts where still do not have any tertiary care. So we have already planned out expansion in Kaithal, Yamunanagar, Ambala, Rohtak, Bhiwani, Hisar, Jind, etc. And we'll be in coming year we'll have at least 10 more centers of similar kind which will be able to provide a very good trauma service, a high-end cardiology service and a very good medical ICU for medical emergencies. And the whole model on which we work is based upon 4 basic principles on which all of us are very passionate about, and that is our mission statement, that we want to provide quality care, we want to do ethical care to the patients where there are no unethical practices, we want to provide personalized care to every patient who comes, and we want that in our environment of a hospital and wherever we work, there is a dignified behavior to every stakeholder, including employees, patients, and their relatives. Thank you very much.